Let's start with the coronavirus situation in the country. South Korea has now reported more than 1,000 daily COVID-19 cases for 3 days in a row. As the crisis worsens, health authorities are continuing their push to secure as many vaccines as possible for the population in South Korea. In fact, they provided more details about their plans in a briefing that wrapped up just around an hour ago now. For more, we have our Choi Won-jong on the line. Wonjong, what can you tell us?
Well, Mark, today's briefing was more about South Korean government being transparent with the public on the COVID-19 vaccine. And here's a part of what they said. Let's take a listen.
We already signed a purchase deal with AstraZeneca and we will complete the contract with Janssen as early as next week. Pfizer is currently under the review.
And the official reiterate the government's previous pledge that they will secure enough vaccine for 44 million people. And they said AstraZeneca's COVID-19 vaccine will be the first vaccine introduced in the first quarter of 2021. However, the briefing did not mention any specific schedules like inoculation dates due to non-disclosure agreements with the suppliers.
OK, so some positive news on the vaccine front, but let's move away from that. We can see now that the virus is taking a stronger grip, seemingly by the day, on South Korea. We have seen, as I mentioned in the opening there, 3 days straight now with 1,000+ cases.
Well, that's right. On Friday, the South Korea confirmed additional 1,062 COVID-19 cases. It marks the third straight day that a new daily caseload has been the 4 digits. All but 26 were locally transmitted, and Seoul alone had 398 new cases. This brings the total national caseload to more than 47,000. 11 more people died. Pointing out some of the major clusters, multiple cases were found at local saunas, 16 in Jeju and 11 in Chungcheongbuk-do province. We continue to see large cluster infections at churches in Seoul and in Chungcheongnam-do province. The government is still cautiously monitoring the situation and deciding whether to raise social distancing levels to the highest tier. They're concerned such a move would do tremendous economic damage. However, health authorities are urging people to follow prevention guidelines before they decide on their next move with local governments, officials, and experts. That's all I have for you now. Back to you, Mark.